Ladies and gentlemen, may I have your attention, please?
Covering both sides of the big issues with the analysis you trust on News Radio 1040 WHO.
President Trump announcing on Twitter early this morning he and the First Lady have tested positive for COVID-19. What's next? Dr. Al Johnson joins me on the Lamarca Law Group Newsmakers line. So, Dr. Johnson, is there any kind of treatment regimen for getting COVID-19, or is it monitoring him, keeping him comfortable? What happens next, doctor?
Yeah, if he becomes symptomatic, then I'm sure they're going to start treatment on him. These doctors are excellent doctors. They understand what's going on. So there's different treatments that are out there that have been shown to be very helpful. Remdesivir is a drug. They've talked about hydroxychloroquine with zithromax and vitamin D and zinc. That has been helpful, and I've used that on numerous patients that I have seen, and they recover very quickly if you treat them early. Mm-hmm. And then there's other like plasma if that's available if symptoms get worse. So yes, there's treatment that works.
And Dr. Johnson, I'm thinking my brother-in-law has recovered from COVID-19. It's interesting that you mentioned vitamin D, also zinc, and that was the regimen he was put on. So it seems to me like some patients are not put on anything medical sometimes. Some folks are being treated with just supplements and vitamins. How is that determined by a doctor?
Well, different doctors have different philosophies, as you probably well realize.
You bet.
And so what hopefully doctors are looking at is what's been working in this pandemic and been talked about. And so they use their experience as well as what's out there in the literature, what other doctors have written or talked about. And always in medicine, early intervention typically gives you better end results.
Which would be, of course, happening in this case because the president's tested constantly. Dr. Johnson, a lot of what I'm reading about today in the medical reaction to President Trump testing positive for COVID-19 was we know so much more today about treating it than, of course, we did a few months ago. You've been tracking the evolution of what we've been learning about this. What have you seen that's really been working well?
Well, from a treatment standpoint, of course, first you want to prevent it. But if you do get it, then, as we talked about, they're using remdesivir, they're using the zithromycin, hydroxychloroquine, combination with the vitamin D and zinc. And then if you have pulmonary symptoms, they're adding in the dexamethasone, the steroid, to help calm down the inflammatory reaction part of it. So those are all treatments that have helped mitigate the disease.
Dr. Al Johnson joining me. And Dr. Johnson, of course, the president is 74 years old, and a lot of folks are saying that puts him in a higher risk category. But has that been your experience? It seems like it's all over the place as to how patients experience COVID-19. Is he at an especially high risk for some complications because of his age?
Well, I think age does play a part, but your total health picture is the biggest part. And he's been a healthy individual, not sick very often, which shows he has a strong immune system over someone that gets frequent colds or infections. So, and he's a little overweight, but he's not grossly obese. It's those grossly obese people that are really having the trouble because their lungs don't function as well because of the diaphragm doesn't move as well to fill the lungs up because of the abdominal fat in taking up space.
Yeah, what have you seen, Dr. Johnson, in your patients? Is it the breathing that's the worst? Is there something you can put your finger on that you say, if your symptoms are going to get worse, these are what you're probably going to experience? What will you experience?
Well, the fatigue, and then, of course, the breathing is the most concerning because you have to get oxygen for life. And so we want to decrease any of the breathing symptom problems as quickly as possible. So that's where the dexamethasone comes into play, or inhaled steroids, to really help cut down that inflammatory process in the lungs.
Dr. Al Johnson joining me today. Dr. Johnson, that's really insightful. Thanks for taking the time this morning